Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Hello and welcome to today's episode. I'm Coral, your host, and I'm joined by Carly Thomson of Pharmacy 777 Wembley and Kathryn Ewen of Dovida today. Kathryn's role at Dovida is a networker. Having a background in customer service and home care coordination, she is passionate about helping people and is committed to providing honest, reliable advice to help seniors and their families understand their home care options and navigate the complexities of my-aged care. Carly is an experienced pharmacist and owner of Pharmacy 777 Wembley, known for delivering innovative health services and exceptional patient care. She is passionate about community health, expanding access to personalised healthcare, and leading her team to make a meaningful difference every day. Kathryn, welcome back to the show, and Carly, it's great to have you joining us today as well. Kathryn, what is social prescribing?
Oh, well, first of all, thank you so much for welcoming me back. Well, social prescribing that we're talking about today is really quite simple. So it's really just about, instead of writing or filling a prescription for medication, social prescribing is about writing a social prescription. So it might be for a walking group or joining a walking group, perhaps some help to give carers some respite if they're looking after a loved one, or perhaps to help organise transport to hospital or medical appointments, or of course, in my case, help to navigate my aged care and understand current aged care funding options. Rather than focusing on medical treatments, social prescribing is about recognising that things like loneliness and lifestyle, access to activities and community connection, they're all playing a big role in how people feel and function day to day. So social prescribing looks at the whole person and gives us the chance to help people access the formal and informal social supports, like groups in their area, to stay connected and active and really just enjoying their life.
It's fantastic. What are the benefits of social prescribing for older people?
Oh, there's so many benefits. As we get older, obviously, we can all expect to go through some big life changes like retiring, perhaps losing a partner, or just managing the changes in our health and independence. And these times can be really challenging. And often we're seeing that they lead to people feeling lonely and perhaps disconnected from their friends and our wider community. On top of that, many older adults are managing more complex ongoing health conditions, which make it harder to stay active or socially involved. Some older people might also be taking on new roles like caring for their partners or perhaps even their grandchildren, which can be obviously rewarding, but certainly overwhelming at times. We might be able to suggest joining those groups, maybe, even just joining your local craft group or connecting the person with a volunteer service. We've helped people with transport challenges, like I say, finding carer support for respite, and from a health system perspective, helping people to engage with their community and putting in regular support from aged care providers such as Dovida has the potential to reduce avoidable hospital visits and reliance on medication. So really, the benefits for social prescribing are huge, and it's about helping older people live well, not just treating them when they're unwell.
Absolutely. Fantastic. So how did Dovida come to be involved in this initiative?
Well, it's funny really, because we didn't really set out to do what we've ended up doing, and it keeps evolving as well. But one of our Perth offices, in fact, the one that I work at most often, is near a Pharmacy 777. So I would go into that myself and get to know the team there. And obviously they got to know me. And then we came up with the idea really just for a sort of one-off healthy aging community event for our local seniors. And it was such a success that we looked at, well, is there any way that we could make this a regular occurrence? Because obviously we only were there for the people that happened to walk past or go into the store on the day. So we reached out to the head office at Pharmacy 777, and the rest is history, really. And like I say, I'm continuing to grow too. So we work in partnership at the moment with a few of the pharmacies across Perth, bringing social prescribing into the heart of local communities, which is really special. And for me, it's lovely to witness that special relationship that the pharmacy staff have with their regular clients. These guys know their people and their families. And so they pick up when these people are struggling. And it works both ways too. So I was in Carly's pharmacy, was it just last week?
Yeah,
The time goes so fast. And one of your teams just welcomed a new baby. And so I watched one of the regular ladies come in, and she'd got like some home-baked treats and some gifts for the babies. It was so lovely for the baby. It was so lovely to see that. So it's really lovely.
Tell me about what your day looks like when you're out visiting pharmacies and supporting older people.
I love this question. It's like, that's a really hard one to answer because honestly, as you can imagine, because we're dealing with people, no 2 days are the same. And that is part of what I absolutely love about it. And Carol and me helping people is my favourite part of the job. So this collaboration with Pharmacy 777 has really been a natural fit. And we love our morning coffee, don't we?
Absolutely. It's beautiful.
So that's been great. And like I said, the pharmacy staff really know the people that are coming in regularly. So when I'm there, I get to step in as a kind of backup support for the team, whether it's helping someone who's just thinking about starting their aged care journey and feeling a bit overwhelmed, or perhaps speaking to a younger family member who's run down and exhausted. You know, we meet those people all the time. Maybe they're caring for their children and also an older adult as well. So I can be there just to take the burden out of finding out and actually give them some helpful information. And it takes the pressure off the pharmacy team as well. They've got somebody that they can trust and refer their patients to have that bigger conversation, because as you know, it can be quite complex at times to find out where people are at and which direction to point them in. So at the moment, we offer the service in 3 Pharmacy 777 locations across Perth. And I also do similar sessions in 3 GP clinics too. And yeah, people can either drop in for a chat on my clinic days or book an appointment through the pharmacy staff. So if I'm not in store when they happen to be in there, they can book in to see me the next time I'm there. So I never know who I'll be meeting and what support they'll need. Everybody's different, but my goal is always the same: to make people feel heard and support them and just give them some tools to take the next step. So I love it also when people pop back in and let me know how they've got on. That's so fulfilling and it's nice to see. So it gives me the chance to do that, being in the pharmacy regularly as well.
What a wonderful job you have, Kathryn. I love your work.
Thank you.
So are there topics that keep recurring when you're speaking with older people?
Yeah, definitely. Yeah, I think I'll put a few down. So my top ones, definitely one of the biggest things I hear is that people just don't know where to start, especially as they get older. It's really difficult. I think so many times people will refer them to a website and people just might not be in the position or even want to do that. So it's nice to be a human being to answer some questions. And of course, really, most people, of course, we want to stay independent in our own homes as we get older. So it's just trying to help people work out how we can support them to do that. So yeah, lots of complaints about the complexity of it. And of course, as we keep talking about it, it just seems to be getting more challenging this year. So lots of questions in that space. I meet at least one person a week who's a bit unhappy with their current care provider, usually just in terms of the things that we hear often: inconsistency of care. You know, they see a different face every week. And that's really hard to hear because nobody wants that. Things like poor communication frustrate me though from providers, because I don't really think there's an excuse for that. So people do have the right to absolutely feel heard, and everybody's different. And we want to, if we don't talk to people and we don't listen to them, how can we help them in the way that works for them? So I like that, that we can do that. Oh yeah, and something else, people that have fallen through the gaps. So it might be that they've phoned my aged care to ask for an assessment and they've been put on the list. And as we know, well, over here, certainly in WA, if the assessing organisation phone that person to make that appointment and they miss, I think they tried 3 times, then they just drop off the list. But nobody knows that they've dropped off. So I meet people that are just that genuinely, like, I've phoned my aged care and I'm waiting. And unfortunately, they'll be waiting forever because I think they might have been dropped off the list. So it's putting people back on track, or maybe they've had an assessment, maybe they've been given some CHSP referral codes and they're waiting for that service to magically appear, or maybe they're trying to put that code in place and the provider didn't have capacity at the time. So again, time's moved on and people have forgotten. So lots of gaps and helping people get back on track. So that's, again, I love it when you can get a measurable outcome. So there's lots of things that regularly come up, but we never know what's going to come up.
Yeah. Carly, how did you become aware of social prescribing?
So I guess in our industry as pharmacists, we like to be at the front. So we like to always present ourselves at the front of the pharmacy rather than behind the dispensary, like historically has been the case. So at Pharmacy 777, we are what we call professional services pharmacists. And we have really been engaging with our patients for a while about how they can better their lives, not just through medication, but through lifestyle changes and through community groups as well, where, as Kathryn has said, we are really engaged with our patients on a regular basis. We do talk to them not just about their medications, we do talk to them about their families, their social lives, their wants, their fears, their needs. So yeah, we connect on that personal level, which enables us to give them that social prescribing. We're able to be part of that community, and we are in that community. So we can recognise if they do need some assistance, whether it be home support or whether it be some mental health providing, or whether it just be community involvement. So guiding them to like a men's shed or something like that. So that's how we have become aware of social prescribing.
Dovida provides high-quality, person-centred home care that empowers individuals to live their life their way. For more than 20 years, Dovida have proudly delivered the highest quality home care to ageing adults across Australia. Each person is unique, and Dovida creates a circle of care that places the older person at the centre of a holistic support system. Whether someone needs a friendly companion, personal care, or specialised support, their care is tailored to individual needs. Their caregivers are skilled, compassionate, reliable, and adaptable. All caregivers are thoroughly screened, fully insured, directly employed, and receive comprehensive ongoing training. Dovida provide home care in the place you call home, whether this is your family home, an independent living village, or residential care. Dovida don't just want to improve someone's day, they empower individuals to live their life their way. For more information, visit their website, dovida.com.au. Why do you think a pharmacist plays a pivotal role in assisting older people to find the support that they need?
We're all very active parts in our communities. So when we look at how our pharmacies are structured, they're open long hours, they're open early and late, they're open on the weekends, and we're not a paid service. We're somewhere that people can drop in when they're getting their medications, if they're unwell or they're well, and they can talk to us. We're freely available to speak with, and we're happy to do that as well. We are part of the communities. We have lots of pharmacists that actually live in the areas that they're working in, so they know what that community is like and they know what that community can offer. And by having those conversations with our patients, we can recognise the gaps that they have in their social support because they come to us for those conversations. I'm a big believer in telling my team that we're not here to serve patients, we're here to make friends. And I think that's a really valuable part of our day-to-day activities. We don't want to treat them as just a patient or a number. We want to treat them as our friends. And again, as Kathryn said, we've got patients coming in to give gifts to our pharmacists because they've had a baby, or they actually bring us morning tea, or they bring us lunch sometimes because they just value the support that we're giving them by learning about them and learning about their day-to-day lives and their family.
And they trust you, obviously.
Yeah,
how beautiful is that?
It is, it's lovely.
So, Carly, what issues did you become aware of with older people that could be addressed or supported by a pharmacist?
If I look back over the last few years, and I don't like to harp on about COVID, but COVID really changed, I think, our perception of how we like to engage. When COVID happened, we craved that social time that we could have. So yes, we only had an hour that we could go outside or socialise, but we all craved wanting that. So for the younger generation, obviously that was quite easy. For the older generation, it was very hard. So that loneliness became something that really moved them out of the community because they didn't have someone to go see or go talk to, or someone couldn't come and see them on a regular basis. So yeah, we found loneliness was a huge part of it. So as pharmacists, we really tried to drive ourselves back into the community by offering things like deliveries to our regular patients, making sure we're that touch point on a daily or weekly basis to them and giving that service to them quite freely to make sure that they have a point of contact regularly.
That's wonderful.
Oh,
That's wonderful. Yeah.
The other issues we found that, again, the internet and social media, older people don't navigate that as well as younger people do. And it is quite a daunting process for them. So again, as we were talking about websites, a website is really hard for an older person to navigate. They love that face-to-face. Hence why coming and seeing Kathryn or seeing ourselves in the pharmacy is what they crave. They love that point of contact. So definitely some of the issues that we've noticed.
So how do you introduce the role that Kathryn fulfills with the people who come into your pharmacy?
So it's been an absolute wonderful meeting and contact having Kathryn in our pharmacy and knowing that there is someone that we can guide our patients to and that we have that mutual trust with. We look at our patients that we see are struggling with social commitment or struggling with their medications, and we just talk to them about what Kathryn can provide. And it may not be that Kathryn's going to lead them down her route, but she's actually just engaging them in the concerns they have with aged care. So yeah, we're talking to family members, we're talking to the patients themselves about how Kathryn can help them navigate this minefield of aged care.
I think people would just jump at that opportunity to hear from someone who knows how the system works and knows what they're talking about.
Yeah.
And we both know Kathryn. We know she's gorgeous and she really does care. So
and incredibly knowledgeable. Like listening to her speak when she is sitting down with one of our patients. I'm trying actually not to talk to any other patients because I want to hear what she's saying because it is so engaging, and it is. I mean, I was talking before that I do have a nana who's older, and trying to navigate her care has been a challenge. And then listening to what is available, it's really refreshing. And having that knowledge from someone who really does understand it is just incredible for us.
Yeah. I think I know what you're going to say when I ask this question, but I'll ask it anyway. But do you find that people are receptive to this model, to social prescribing?
Absolutely, they are. Absolutely.
Of course.
Yeah. As we said, people crave contact. They crave people. They crave attention in a positive way. I was honestly talking to a lady yesterday. She says, I'm a bit lonely. People my age complain about the ailments. And I said, well, why don't you look at joining a surf club? And she said, I never thought about that before. She enjoys doing physical activity. She swims. She likes cycling. So again, we talked about a surf club. So in our pharmacy, we're located close to the ocean. So we're very lucky in that respect. And surf clubs do provide that community outlet. They provide social network. They provide sport. They provide community volunteering. You've obviously got surf lifesaving and patrolling beaches. And she walked away feeling so thrilled that there was another option that she could have to just the day-to-day. So, yeah, she said, I'll come back next week and let you know how I go. Yeah.
Fantastic. It sounds like maybe it was almost like she needed the encouragement and maybe some permission to go out and do something that maybe no one else, none of her friends are doing, that it was okay.
Yeah.
So I asked Kathryn this question a moment ago, but from your perspective, what are the recurring topics that you're seeing or hearing from older people coming into the pharmacy?
So the main one would really be loneliness. So the loneliness that the older age group is experiencing, whether their family is busy or moved away, or obviously, I guess my generation is called the sandwich generation. So, we're busy working and taking care of our kids, but also looking after our older parents and families as well. So the loneliness that older age group is experiencing, I do have some stats on loneliness. Apparently there's 1 in 5 older Australians who are socially isolated, with up to 1/3 of older people in residential aged care. So participating in social activities and joining groups or clubs that can really help to avoid feeling lonely. But again, them knowing what clubs that they can join or knowing those activities that they can do is something that they don't know how to access, because the next option is they don't know how to navigate these online systems.
That's
so
right.
much has moved to social media that they don't understand that. So that loneliness comes in again because they don't know how to access it. Yeah.
So I think Kathryn mentioned that there are 3 777 pharmacies now participating in social prescribing.
Yes, that's right. Yeah.
Are there going to be more? Do you hope to roll out?
Well, look, we definitely
to
hope
roll-
to roll out more. I guess from a Pharmacy 777 point of view, we have always, as I said, encouraged that not just prescribing medication, in prescribing or introducing other health outcomes. So for a long time, we've had what we call a health outcomes pad where we can write down information. So yes, you might write down, Mrs. Jones, you're taking X medication at this time. However, what you can also do is make sure you go exercise. So do a walk 3 times a week, or go join a gym and enjoy health exercise that way. Or we could even say, find a men's shed, and this is where the men's shed is. So we've been, I guess, innately doing that anyway, but obviously having Dovida as part of that process, we would love to obviously see that be rolled out in more pharmacies for sure.
And I'm sure you'd love that, wouldn't you, Kathryn?
Oh, definitely. Yes. Yeah. So yeah, we kicked the project off back in September last year with that one-off event. So it would be nice to see it expand. We certainly wouldn't look to put it in every single pharmacy, but I think picking a few key, and obviously yours is just the best because the coffee's awesome and we're near the ocean. But being in Wembley is near the city for us, so it's a nice central location. We're also in Whitford City, which is quite a big shopping centre, so we've got a different demographic up there that we can help, and then all the way down in Mandurah, which for those that don't know, WA is it's about an hour away.
Yeah, about an hour
So
away.
we've got a good spread, and then we'd like to get one sort of on the other side of the city as well. So watch this space for that one. But yeah, it's been amazing. I think that it's lovely, like I say, to break down those barriers and be available for people to just have those conversations. And I wrote down here that I felt like it is one of those rare situations where we are all benefiting. So patients are getting better access to care and services. The pharmacy team has got another tool to support their community, and we're actually able to be in the community talking to the people that we're trying to help. So yeah, it's win-win-win.
Yes, definitely win-win, definitely win.
Kathryn, do you think that makes a difference, being present and in person and having these face-to-face conversations with older people or their family?
Honestly, I think so, yes. And I know I will often have phone calls with people, obviously with their consent, to help them navigate the conversation with my aged care. And so often that leads to a comment where it's available online, or visit the My Aged Care website, and just that in itself is just a barrier. And literally people would throw their hands up in front of me and be like, it's too hard, I don't want to do it. And I just take that as a nice challenge to be like, no, let's help you. Because you know what, these people, these older adults, have worked all their lives and they've paid their taxes, and it's about time they got something back to help them when they need it, and let us help them get that help. But it's frustrating when we see people that really would benefit from some support and they've got a barrier to accessing it. So no, being able to have that face-to-face conversation is so important, and I genuinely love it.
Yeah, we love it.
Yeah. This has been a fabulous discussion, and I applaud you both for your willingness to tackle such an important issue. Kathryn and Carly, congratulations on the difference you're making in the lives of older people, and thank you so much for joining me on the show today.
Thanks, Carol.
Oh, thank you.
Hey Care community, thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.